Hey, good evening. Welcome to the show. Stay tuned for Wintertime Injuries. Special guest tonight. Good evening. Tonight's guest is Dr. John Landis. He's our emergency room director, board certified emergency specialist. John, welcome to the show.
Thank you. Good to be here.
Hey,
again.
thanks for coming tonight. Tonight's topic you picked was wintertime injuries.
Wintertime injuries.
Tell us a little bit about wintertime injuries.
Well, as you know, a lot of injuries occur when seasons change. Certainly see in winter only sledding accidents. We see a lot more motor vehicle accidents, skiing accidents. So there's a whole host of injuries that, they're not limited to winter, but I suppose injuries that could be limited to winter might be some frostbite and things like that get into the realm of the exposure type of injuries. But, skiing injuries, sledding injuries, and sliding around like a maniac in your car on the ice usually happens at the first snowfall. You want to stay off the road. That's my bit of advice. Stay off the road.
Stay off the road or they'll come to meet you.
Yes, they'll come to meet me. That's right.
Well, PennDOT probably got their allotment of salt now, so they're probably going to start putting some on the road, I would imagine.
Hope so.
When you talk about, what's the most common winter injury that you see?
I would say that the most common winter injury would be some sort of fracture, usually of the upper extremity. It's
Okay.
usually from sitting on or slipping on ice, far and above any other type of injury. It would be an extremity injury,
Okay.
upper, lower, but most commonly the wrist.
Any age group, or is it more confined to the older folks because of the osteoporosis?
Well, certainly, as you well know, that someone with osteoporosis is much more likely to sustain a break than someone without the weakened bones of osteoporosis. And the other issue that goes along with osteoporosis and aging is the instability that can come along with changes in balance and just your changes in your walking mechanism that can lead to increased risk of falling and slipping and falling on the ice. And typically when someone does slip and fall, what they will try to do is break their fall by putting their hand out, and that usually results in the fracture of the upper extremity that we see with slipping.
Like a wrist fracture?
Like a wrist fracture, right.
How can you tell the difference between, say, a fracture and just a severe sprain or a strain?
Well, interestingly, in children, it's often more difficult to tell because oftentimes their bones don't break as older folks' bones break. Sometimes they will have an incomplete fracture. We call it green stick fracture, which is pretty much can be just look like localized swelling. You say, oh, that's just a sprain or just a bruise. But generally, in younger kids, if they continue to persist and talk about complaints of pain for a while, then it is more likely to be a fracture than it is to be a sprain. Older folks, it's a lot easier because a lot of times there's obvious deformity that your wrist will look like a dinner fork, or you'll have pain when you move your elbow, pain when you move your shoulder. Often in elderly individuals, that's more likely to be associated with a fracture.
Okay. And when you say green stick, you're talking about that young wood.
Right. Yeah, to clarify that, when you take a sapling stick that's ripe and green and try to break it, oftentimes just the outside of it will kind of crack, and that's what happens in a green stick fracture in a child, also known as a torus fracture, where sometimes there can just be kind of a buckling, and it's not really a complete fracture of the whole aspect of the bone.
The other thing, and you may have pointed it out, was the kids tend not to use the extremity when they break something.
That's right. That's especially true in younger individuals. If you have a small child that maybe can't express exactly what's wrong or what's hurting, a sign might be that they won't use the extremity, and that they'll, despite being handed a toy or something like that, that they'll continue to not use that.
Got it. In case you just tuned in and have just switched over from the CBS Evening News, which, according to ratings, nobody really watches the CBS Evening News. No, who would watch that? We have Dr. John Landis tonight. We're talking about wintertime injuries. Let's change gears just for a second and talk. I found something interesting when we were preparing for this. Heart attacks in women. Mm-hmm. Let's say they're out shoveling the snow, if we can get them out there shoveling the snow. I was interested to see that their presenting symptoms are much different than men.
Right. Typically, when someone would think of a heart attack, you would think, well, you got to have chest pain to be having a heart attack. And even in men, that cannot be the case. But a lot of times in women, we do see that quite often they have complaints that are kind of nonspecific. And so we have to really what we call risk stratify them. And, certainly if they have risk factors, smoking, diabetes, high blood pressure, to name a few, high cholesterol, obesity, inactivity, those sorts of things. And we have to really be on guard for whether this presenting symptom, which may be something as obscure as generalized weakness for a couple of weeks, that it might relate to there being a blockage in an artery in the heart.
You say that weakness is one. What are some of the other symptoms that you see specifically in women that have heart disease?
Right. Well, they're not just specific to women, but perhaps more common presentation than chest pain. Certainly would be fatigue, shortness of breath.
Mm-hmm.
Shortness of breath is probably, in doing some retrospective studies, shortness of breath is probably the most common presenting symptom in a woman that has heart disease, that again is atypical. And we may bring those people in and do the electrocardiogram and do all the blood work that's associated with working up heart disease, just as we do in men, and oftentimes just based on their symptoms and maybe non-specific findings on all their testing, we will go ahead and admit them for further testing and a stress test.
Okay. And as a warning to all the women out there that think that, as I was accused of looking at the world as a collective gallstone, there are certain symptoms that really overlap gallbladder disease.
That's right. Certainly gallbladder disease and a lot of GI diseases, gastrointestinal diseases, can mimic cardiac disease in both men and women. Now, gallbladder disease is a little bit more common in women than it is in men. So certainly symptoms of indigestion, symptoms of pain in the epigastric region, which is just your solar plexus right below your rib cage, might indicate something is wrong with your heart rather than gastrointestinal. Oftentimes, women will complain of feeling the need to belch or rift or feeling an indigestion type of symptom.
Better call some ice in here if you're going to talk of those symptoms. Interestingly, we got to pay attention then. If it's a woman, she's having chest pain, get to the emergency room, get to your doctor. Don't just say, oh, it's my gallbladder or it's my ulcer acting up or I just have some irritable bowel syndrome.
That's right. I think if you're 55 or older, certainly if you have exertional-related shortness of breath that seems to be perhaps out of proportion for what you've had in the past, perhaps you have increased weakness that is out of proportion to what you've had in the past, not just chest pain. That if that persists, you might want to get in to see a medical professional.
Interesting segue. We can go right into skiing, but I'm going to talk a little bit about heart disease. One of our good colleagues' mothers, avid skier, went out to Colorado and just thought that she was having some altitude sickness. Turns out she had heart attack.
Right.
And, so we can talk about skiing, but if you're a more seasoned individual, as I am, and went out this weekend with my daughter, those are things to pay attention to.
Sure.
Especially if you're a woman.
Yeah, and especially in the altitude. There's a whole significant, interesting medicine to altitude illness and brain tumors and cardiac disease that can actually be precipitated by the decrease in oxygen just as you go up 5,000 feet, which is a mile.
Okay.
Which is a mile. The oxygen does drop pretty significantly and can bring out the
Symptoms that you
disease.
otherwise wouldn't have.
Right.
Okay. Skiing. Let's talk a little bit about skiing. I was out over the weekend. Not a lot of people out there. One of my close friends told me before I went out, he said, "You got a helmet?" I never used a helmet because I rarely fall.
Mm-hmm.
But once I saw these torpedoes, these young people that are doing the show tonight, go flying by me at 200 miles an hour, I thought that I might just be this little duck, in the way of a large torpedo. So I think the next time out, I'm going to purchase a helmet.
Yeah, that's probably a good idea. Certainly, I was out skiing. I ski about once a year, and I was out skiing last year, and I did wear a helmet. And I did that because I'm not a good skier. And I think that the more you fall and probably the worse skier you are, the more important it is. But hey, anybody can have a momentary lapse in their skill. Look at Sonny Bono, who was probably a darn good skier and, ran into a tree. And I don't believe he had a helmet on.
No, he
and died of massive head injury. And that's the concern, and what we're trying to protect with the helmet is significant head injury.
Is the coconut.
Is the coconut. That's right. The
so,
pumpkin.
if you're skiing, get a helmet.
Right. Now, I think especially all my kids wear helmets, anytime that they ski. They don't wear them sledding. I'll give them that.
You have to talk to them about that.
I'll give them that for now. One's already had a skull fracture, not from... He fell off a changing table, so
right.
He's had his skull fracture for his life.
Yeah,
We
sure.
figure he's pretty protected for now. So,
well, let's talk about skiing because I'm not skiing, sledding. I think it's important where you sled.
That's right.
Because last year, somebody was sledding. Fortunately, I don't go very fast in the neighborhoods, and I tell people to please slow down in the neighborhoods. But we had a kid come right out into the street and right across the street. It's a street.
Yeah.
I mean, it's amazing to me.
Right. I remember driving home just earlier, one of our first snowfalls this season, and there was a hill that, while it didn't exit onto the highway, certainly any mishap would have taken them over the hill and onto the highway. I thought, well, that's a crazy place to sled. So you really need to sled on a hill that's not too steep and certainly is nowhere around any traffic. Seems like common sense to us, but
right. Well, the steeper the better if you're a kid. I remember that, but certainly, please, because keep an eye on these, characters because they're new and want to explore, and sometimes they don't see the real dangers. And John and I have both seen some really tragic accidents that could be prevented just with an ounce of common sense. Not that people don't have common sense, but it's just turn your back for a minute and somebody can have a real problem.
Right.
Are there any guidelines to, we try to keep the kids, depending on the temperature, not out for more than a half hour, 45 minutes. Is there any specific guidelines that are out there?
Well, there's not really specific guidelines. I think certainly when you're active and you're, trudging up and down a hill or exerting yourself skiing, that generally you're not going to develop any sort of cold-related illness as long as you're physically active and keeping the body warm. We don't really live in an environment where we get into the teens and sub-zeros, for long periods of time. Sometimes we do, but those are really the times that are most important to keep an eye on your kids. But my kids will go out, for 4 or 5 hours in 20-degree weather, and they will be fine. They'll come in with rosy cheeks and complain of numb fingers, but that numb fingers is just the cold-related vasoconstriction that really is of no consequence. So, I think along with the helmet and in that same vein is as long as they're appropriately dressed.
Okay.
As long as they have, the appropriate boots and they're not wearing, just tennis shoes that get soaked and wet and frozen, that they have the appropriate snow boots, snow pants, hat, scarf, gloves, all of those sorts of things that kids will generally come in when they're feeling too cold.
What temperature should we worry about? You were saying like the teens. Is it anything below 20 degrees?
Well, anything that the wind chill plays into it too. So there's not really a hard and fast rule about exactly what the temperature is, but certainly when you get into the 10 to 20 range with any sort of wind chill, you can become at risk for having some exposure to, your nose and face and
other exposed areas.
That's right.
Again, if you just tuned in, John Landis, our emergency room director, is here tonight. We're talking about wintertime injuries and associated issues. I saw something was interesting, and you talk about being careful in the snow, and it said like if you're taking the garbage out and things like that, to walk down the grass because it's safer than walking down the concrete, especially if there's a little ice on there.
Right.
Or if you have a hill like I do to get down to your street. So it's something to think about, and I don't know if we think about it too much or not, but just throw that out there for you.
Well, the interesting thing about grass, though, is it's pretty slick. If it's a little bit slushy, I've taken care of just recently a couple of nasty ankle fractures from slipping on a slightly slushy, grassy hill.
Okay.
So,
So I take that back. Just stay inside.
Yeah, just
let the
stay
garbage
inside,
pile
right.
up.
Have someone else take the garbage out.
Call John.
That's right.
I'll take it out to the curb for you.
I think getting it shoveled and getting some salt down is probably the most reasonable way to do it.
Assuming you're not smoking your cigarette while you're doing it.
That's right. That's right.
Even though you're outside. Again, while looking at this, let's talk a little bit about osteoporosis and how you think that may relate to wintertime fractures, or does it?
Well, I think that it does, osteoporosis being the weakening of bones, the loss of calcium in the bones. And fortunately, I think as we have progressed in medicine, we have been able to help women to arrest it a little bit earlier. So, while they may still be developing it, it's not nearly as bad as it's been pre-treatment with some of the calcium supplements and Fosmax and some of the other medications that are available to treat osteoporosis. But certainly it leads to weakening of the bones, which leads to some pretty horrific fractures that we see. So yeah, it does play a part in in my practice and having to evaluate people, as well as having to treat them. Somebody that has an osteoporotic fracture oftentimes has to be operated on to get that fracture reduced, because the bone that's fractured is oftentimes splintered in so many pieces.
Are there any common sense guides to help people, especially women, prevent hip fractures in the winter?
Well, I think, again, talking about potentially osteoporotic women, I think that staying indoors for the whole winter is probably the most reasonable thing. But no, beyond that, you really just can't put yourself at a place where you would be at risk for having that happen.
So don't get in the front of the line at Walmart at 6 when they have the grand opening.
That's right, because you will be trampled.
Right.
For that wee.
That's right. Interestingly, I saw another thing that helps around the house. They talk about, try to keep the piles to a minimum, and night lights at night for the, so you don't stumble on something. Do you see a lot of that at home, or just it's like clumsy injury, that kind of thing?
There are a lot of clumsy injuries. Oftentimes,
it's the rare person that says, "I think I'm going to go break my hip today."
Yeah, that's right.
Okay.
Yeah. Oftentimes, we do see people that fall at night, and oftentimes it's getting up to go to the bathroom. And, they may use a walker or something like that. And, I'm just walking over to the bathroom, and I'm not going to use my walker. But it was dark. It was dark, and the last thing I remember was waking up, and I was wedged between the toilet and the wall.
Tripping over Sparky.
Hip. Yeah, tripping
Sparky
over
the dog.
Usually it's tripping over their own feet or the covers.
Fluffy slippers.
Fluffy slippers. Covers on the bed oftentimes leads to them getting tangled up and falling on those.
Okay.
So night lights certainly would be a reasonable thing to put out through your house to light it up.
And certain medications that you take, or any of them more sedating than others that you have to watch, especially during this cough and cold season?
Well, some of the certainly some of the cough medications can be sedating. Some of the medications that we put people on to help them sleep, those could be sedating, and those can mess up your equilibrium a bit. So you roll out of bed to use the bathroom, and you might not be quite as steady on your feet. There's certainly blood pressure medications, prostate medications. The list is pretty endless. Mm-hmm. I think when you start to take those medications, you kind of have to get your sea legs with them. If they do affect your balance, make you unsteady, then you need to talk to your doctor about it so that you can either have the medication changed, or you can figure out a way to approach it and be balanced with that medication.
Okay. And just be on a high state of alert when the weather changes.
That's right.
Okay. What type, do you see a lot of spinal fractures from osteoporosis in the emergency room?
We do. It's very common. I would say that hip fractures, extremity fractures are certainly rank up there as being some of the most common. But we do see quite a bit of what we call spinal compression fractures. And interestingly, I have had osteoporotic, mainly women, who have done nothing more than had a hard sneeze and have fractured thoracic vertebrae.
Wow.
And it compresses. And unfortunately, that is a profoundly painful process to go
mm-hmm.
through, and the pain lasts a long time.
Okay.
There are some procedures now,
right.
Kyphosis, that help with it, but
mm-hmm.
still is painful.
We had the interventional radiologist on to talk about that.
Kyphoplasty.
Right.
Yeah.
Want to talk about that?
I don't do it, so
Okay.
I say, yes, you have a spinal fracture, here's some pain medication, and I'll hook you up with someone to fix you.
Get the guy that can take care
That's
of it.
right.
Perfect.
That's my job, you know
I
that.
understand. I understand. Again, Dr. John Landis is on tonight. We're talking about wintertime injuries. We've talked about sprains and strains and fractures and heart disease in women. It's also cough, cold, and flu season.
Right.
If you're out there in TV land and you've not been feeling well for a few days, how do you know if you've got a cold? What symptoms should you, say, oh, I got a cold, there's no reason to go to the emergency room, mm-hmm. versus, man, I think I might have the flu. I better get in there and get checked out. I heard this is serious.
Yeah. Well, if you, the flu season really isn't upon us here in Western Pennsylvania. Let's start off with that. Certainly it will be coming, but, Pennsylvania, the last CDC report I had it's sporadic here. It's a case here and a case there. Mm-hmm. And a lot of those could probably be traced back to, I think, Texas. It's a little bit more widespread, certainly.
Texas.
Texas, yep.
A lot of problems coming out of Texas.
A lot of problems coming out of Texas, including the Cowboys.
I understand.
Right. Could be traced back to the perhaps traveling to some of those more endemic areas or areas where it's more widespread. So we haven't seen a whole lot of it here. Unfortunately, the treatment of flu, there's just not a whole lot. I think that if you fall into an at-risk category, that's when you really need to think about being seen, even if you do think it's the flu. If you are healthy like you and I assume that you're fairly healthy.
As far as I can tell.
Good. That there's not a whole lot I can do for you. If you've been vomiting, I can give you IV fluids and hydrate you.
So you're telling people to get their flu shots?
Get your flu shots.
So who's at risk, do you recall?
I do recall.
Go ahead.
That would be elderly folks with
elderly
a number of comorbidities with lung disease, heart disease, kidney disease, liver disease. That would be the very young, infants and young children. Okay. And then that would be anybody that has any of those what we call comorbid or diseases that put you at risk. Diabetes, asthma, chronic obstructive pulmonary disease, heart disease, congestive heart failure. Those are the people that I want to see, before they get too bad. In those people, oftentimes it's not just the flu that's the issue. It's the secondary infections that can develop. You get the flu, you develop this cough, and then pretty soon you have a bacterial pneumonia, and that's a life-threatening problem that needs to be treated.
So the person that comes in and asks you for antibiotics for their cold or flu, what do you have to tell them?
Well, that's often that's a big challenge, because people want to have something to make themselves feel better, and oftentimes with a lot of viral illnesses, I can't swab it and say it's this virus. If I could do a flu swab and say you have the flu, I can usually convince someone that they don't need antibiotics. But oftentimes it's very difficult when you've had a cough to convince you don't need an antibiotic. Excuse me. So generally, you try to educate them that antibiotics are not used for viruses.
Which are the common causes of flu?
That's right.
And colds.
Right, and colds. We see a lot of viruses these days lasting 2 or 3 weeks. So they say, well, I've had this 2 or 3 weeks, I'm tired of fighting it. If you've had it 2 or 3 weeks, it's not bacterial, and antibiotics are not going to help you. It's got to be a virus, because that's what hangs on for 2 or 3 weeks are viruses.
How about other things do you see this? Do you see any increase in ear infections or nasal infections this time of year?
Well, what's associated with increased ear and nasal infections or increased viral infections, and generally what happens is a child, usually a child, you see it in some younger adults mainly, but you, with a viral infection, you'll develop the runny nose and the congestion, and that ends up blocking off the eustachian tubes on the inside. And when that happens, the fluid can build up and subsequently become infected, and that's why we see an increase in the cough and cold season of ear infections, which are most likely bacterial, although there's a lot of studies out there that advocate a watch and wait approach to them.
Got it. We've had Dr. John Landis tonight talking specifically about wintertime injuries. One of the big topics we talked about was heart disease in women, especially during the wintertime. You want to just kind of briefly roll into a summary, John?
Sure. Well, I think the summary of the injuries would be to be careful while you're out walking in the cold and snow. Certainly if you have any sort of osteoporosis or any problem like that you want to take extra care. We talked about injuries associated with sledding and skiing, as well as just being out in the icy environment. And I think that, again, you want to wear a helmet if you're going into any of those activities. Should you sustain an injury, you want to do the rest, ice, and elevate type of issue that we were discussing before we got on here. Related to heart disease in women, we're seeing increasing amounts of it. We're probably picking up more of it now. And if you're a woman that has cardiac risk factors, high blood pressure, smoking, that you want to pay attention to fatigue, indigestion, shortness of breath, because those might be an indicator of some heart disease.
Right. And if you're having any of those, call your family doc first, but if it's after hours, you'll get to bump into our friend Dr. John Landis, Emergency Room Director at Canonsburg. Great guy, really smart, and hopefully you won't have to see him except on our TV show.
It's the nature of my business.
John, thanks for coming tonight.
I appreciate it.
No problem.
I enjoyed myself.
Thank you, sir. We'd like to wish everybody out there in TV land Merry Christmas, Happy Hanukkah, Happy Kwanzaa, and have I missed any? Happy Ramadan, I guess maybe.
You covered them.
I got them all. Wear your helmets out there when you're skiing, sledding. Avoid the streets. Avoid the cars. Stop smoking. Stop. Anything else?
Wear your seatbelt.
Wear your seatbelts. You don't want to see
good.
Dr. Landis. We didn't mention that.
That's right.
That should be year-round, though.
Absolutely.
Hey,
Absolutely.
have a great New Year. We'll see you next year.
Merry Christmas.